So welcome to our Digital Opportunities webinar series. I'm Ann Byers, the Digital Equity Manager for the state of Nebraska. I'm with the Nebraska Information Technology Commission and Office of the CIO. We will be meeting on most Wednesdays at 11 a.m. starting last week and going into May or June. The webinars provide an opportunity for us to learn together and to support state and regional digital equity planning efforts. Today's webinar focuses on the digital equity needs of older adults and resources for older adults and helping them to use technology. Please put your name in the chat. This will help us track attendance. And also, if you would like to be added to our email list, please include your email in the chat. We will be recording the webinar. A copy of the slides and a link to the recording will also be available on the NITC website. The Nebraska State Digital Equity Planning Initiative is part of the Connect Nebraska Broadband Initiative. This planning grant is being led by the Nebraska Information Technology Commission, Office of the CIO, in partnership with the Nebraska Regional Officials Council and the Nebraska Library Commission. This initiative was funded by the Digital Equity Planning Grant from the National Telecommunications and Information Administration. And we have three great speakers today. Gina Bragland from AARP Nebraska, Cynthia Braumeyer from the Nebraska Department of Health and Human Services State Unit on Aging, and Carla Frazee from Blue Rivers Area Agency on Aging. And with that, I'm going to turn it over to Gina.
Thank you, Ann, and thank you everyone for your attendance today, and most importantly for your interest and work on all of this. Again, personally want to thank Ann for her ongoing work and commitment to the initiative, as well as thank the Nebraska Information Technology Commission for embracing and supporting the work ahead. I also, colleagues on the line on today I want to thank Cynthia from the State Unit on Aging and Carla from Blue Rivers Area Agency on Aging, as well as all the Nebraska area agencies on aging. Mostly for their ongoing work on these issues, but also all the support and services they provide by their agencies to aging Nebraskans and their families. ARP is appreciative that Nebraska is participating in the Digital Equity Planning Grant Program, and it's through these discussions that Nebraska will be able to prepare a plan and ensure that all Nebraskans can access, adopt, and utilize correctly by all households across the state, while also allowing all Nebraskans to participate fully in today's increasingly digital economy, and most importantly, to allow Nebraskans to age in place and choose where and how they age. Next slide, Ann, please. Older adults are one of the largest demographics without meaningful use of the internet, and this has severe implications for individuals, families, communities, and our nation. Those implications are as wide-ranging and diverse as older adults themselves. For some, the lack of internet use means not taking advantage of tools that could help reduce feelings of loneliness. For others, this could mean an inability to manage finances online or use telehealth services to stay safely at home, or eliminate a full day away from work or home to travel hundreds of miles for a medical service. As a whole, being on the wrong side of the digital divide means older Nebraskans and Americans are not using the tools that could help them live happier, healthier lives. We know that nearly 90% of adults over age 50 across all age, race, income, and health status categories want to remain at home and age in place. Digital equity, digital literacy, and digital access are some of the keys to ensuring that success. Digital tools increasingly support critical functions, ranging from enabling access to healthcare services to facilitating everyday communication. We also know that 60% of the global population is connected to the internet, yet 22 million adults across the United States, especially in rural areas, lack broadband access at home. Closing the internet access gap for aging populations is not only a matter of equity, but also important for improving health, economic, and social outcomes, and also increasing one's overall quality of life. When older adults feel empowered to learn new technology, they transform their own lives and change their communities too. For many people, picking up the iPad to pay a heating bill or accepting a video call from a friend, or even hooking up their computer or smartphone, tablet, etc., to access a healthcare provider may feel as easy as picking up a phone off the wall, as we've done in the past. But for others, including many older adults, real barriers keep these technological abilities out of reach. Older adults may lack access to the internet, knowledge of what they could be accomplishing with technology, or the basic confidence to start learning new tech skills. Seniors' technology use skyrocketed during the pandemic, viewing technology more positively than they did before. And even as more adults are growing comfortable using technology, there remains a digital divide in our country. Again, as I said before, with millions of older adults lacking internet access. Poor broadband not only limits access to essential public health information, social services, and digital healthcare services like telehealth and appointments that manage chronic conditions, but it can also lead to risk of social isolation, depression, and loneliness, which have been linked to negative health outcomes, reduced quality of life, and premature death. The rapid and accelerating pace of technological change is making it increasingly difficult for older adults to develop the necessary digital skills to effectively use new technologies. Even when internet connectivity and digital devices are available, developing the skills to remotely access healthcare, shop and bank online, and stay connected with friends and families may be exceedingly challenging. New digital devices can be expensive, require software updates frequently, and are often incompatible with pre-existing technology. This all compounds the challenges that older adults face to acquire and maintain those digital skills. The share of Americans with no digital skills remains steady, and by the age of 80, nearly 40% of Americans lack basic digital skills. I'll have you do the next slide, Anne. So in 2021, AARP formally joined the Older Adults Technology Services, or the acronym for that is OATS, to help seniors across the United States harness the power of technology, no matter their socioeconomic, geography, educational background, or their age. The OATS website is up on this slide, but again, https://oats.org. As part of the OATS program, the Senior Planet programs were designed to assist older adults build technology skills to improve social engagement, financial security, civic participation, health, and creativity. OATS also frequently authors and contributes to studies, reports, and academic journal articles that shed light on the intersection of technology and specifically with older adults. Senior Planet also offers free online classes and events every week on topics of technology, fitness, social engagement, and much more. Senior Planet is a distinctive, diverse community of people aged 60 and older who are busy shaping the way they embrace opportunities to reshape their lives, connect with and help one another, and change the world for the better, all while learning, growing, and having fun, and again, eliminating that social isolation and depression factor. Senior Planet curriculum includes nearly 100 multi-week courses, lectures, and workshops that people can choose from. The Senior Planet website, again, is listed up here on the slide, and again, you can visit that and access further information. I also want to mention the Senior Planet also offers a licensing program that equips local organizations with the tools to help older adults access technology and use it to enhance their lives. The licensing program structure works with community-based organizations to develop local trainers to deliver curriculum and bring world-class programs to older adults where they live. Specifically, these licensing programs, we have been working with libraries and community colleges and have a couple of those on board here in Nebraska. They have not yet fully completed that training, so I'm not able to mention them today, but we are working to bring on a couple of libraries, a couple of community colleges across the state, again, under the licensing program. As a licensee participant, they receive all the training free. They become a licensed program under Senior Planet to do programs in their communities or in their locations. The only caveat is that the entity would have to provide the equipment that for the computer lab for people to come to for that type of help. The training is all free, the curriculum is all free, it's all available under that licensing program. And as I mentioned, also the local trainers, that's another piece of Senior Planet, is finding people locally within the community who would be willing to become trainers and provide that education curriculum training at those sites as well. As I mentioned, AARP Nebraska has been working with libraries, community colleges, and other entities across the state to utilize these tools and others to provide education, training, and outreach free of charge to meet the needs of all aging Nebraskans to get and keep them technologically connected. Senior Planet also has a tech hotline. It's an 800 toll-free number, a free service where older adults can speak to technology trainers and have their questions answered via the hotline. So if somebody doesn't want to use the computer to do that, they can just pick up the phone and call and be connected with a service provider through Senior Planet, again, that are technology trainers, and walk through a problem to get it resolved and so forth. Next slide, Anne, please. This is just a word cloud, and the reason I kind of put it in here is this really illustrates, and there's many more topics, but this illustrates a variety of many of the types of programs and curriculums that's provided through the Senior Planet program. Again, noting all of these are no cost and free to all, and again, very busy slide, but you can again get the gist of the variety and the levels of what's available, and this is just a very small list. If you're interested in knowing what else is available, again, I would encourage you to go out to those websites that were provided. 90% of adults age 50 and older want to age in place, and by 2030, 21% of the population will be comprised of adults 65 and older. Additionally, by 2030, the 65 and older population will outnumber the number of children for the first time in history. And by 2060, the number of older Americans will increase to 25% of the population. We must change the way we are doing things, and most importantly, find ways for older Nebraskans to age in place at the lowest level of care. We feel enhancing our digital outreach to aging Nebraskans is critical, and it's a large piece to do that. In closing, we appreciate that Nebraska has been able to provide different options for aging Nebraskans to access learning and education for technology development. Truly, there is not a one-size-fits-all model. We appreciate partnering with all the entities across the state and working to assist in meeting the needs as they arise, and creating innovative ways in all communities across the state to share all those options with Nebraska. We appreciate the opportunity to be part of the ongoing conversations, and appreciate and look forward to hearing from Nebraskans as well as you as entities working on this project from all parts of the state as we move forward to implement affordable, reliable, accessible, and of course, technologically utilizable high-speed internet for all Nebraskans, regardless of their age or location. And with that, that's all I have, Anne. I'd be happy to either answer questions now or at the end.
Yeah. Does anybody have questions for Gina? You can put them in the chat. We'll do most of our questions after all of our speakers, but we might have time for a quick one. I don't see any questions right now, so let's go on to Cynthia. And
Can you
thank
hear
you,
me?
Gina, for your great presentation. So sorry, Cynthia.
Okay, good. Okay. So I'm Cynthia Braumeyer. I'm the administrator with the State Unit on Aging. So thank you all for participating, and big thanks to Anne, Gina, and coming up soon, Carla. We are a small unit within the Division of Medicaid and Long-Term Care. Our federal funding is through the Administration for Community Living, Administration on Aging. We also receive 2 sets of aid funds from the Legislature for Aging Services. We fund area agencies on aging, and they in turn fund senior centers and programs at the local level. The AAAs, as we refer to them, offer an array of some 40 or 50 services at the local level, and then they make those decisions within their boards and communities. The running joke is you've seen one AAA, you've seen one AAA. Each one is different. All of the AAAs do offer meals, and they offer congregate and home delivered. Those programs can be Meals on Wheels or other agreements. They all offer some form of case or care management, information and referral, caregiver programs, in-home services, and support senior centers. Beyond that, it's a real mix of services and programs that AAAs and their boards see as the most useful in each community. And I'll share some information on 2 surveys that we conducted in the last year and an online learning platform, in addition to what Gina talked about, that we purchased classes on. I truly believe that aging in place, especially in rural areas, will require digital equity. Next slide.
Oops.
So, yep, that's it. This is a map of the service areas for the
years now, and it's working for me.
Prevagen at stores everywhere without a prescription.
Okay. Just a reminder to mute your microphone if you're not speaking, and I will also see if I can mute everybody. Okay, we're good.
Okay, we'll start over. So this is a map of the service areas for the area agencies on aging. And in a normal year, we fund about 20 million to the agencies. And with the pandemic, we have been funding about 40 million. Next slide. So we did a survey, or we contracted for a survey through the University of Nebraska Omaha Gerontology Department and the Center for Public Affairs Research. They conducted in-person listening sessions at 19 locations across the state, and they did a paper and online survey of adults age 50 and over. And we'll just give a little bit of information about the gender and ages on this survey. You can kind of see the breakout, which is not surprising. Women age, you know, they last longer than men. So, okay, so I got the next slide in the wrong place. So skip to, or skip to where it says UNO executive summary. Okay. This should also come as no surprise. There's a higher concentration of adults age 50 and up in rural counties, and the population age 50 plus in Nebraska is 88% white, non-Latino. Next slide. These are the statistics on who attended the sessions. 271 people attended the in-person sessions. They ranged in age from 55 to 95, and the average age, or the mean age, was 77. Again, it was mostly women, about 67%. 97% were non-Latino, and 94% identified as white. We had 40% of them were married, and 14% were providing home care to a family member or a friend. Next slide. Part of the support services answers were summarized here, and these are aspects of aging in place that are important to this population. And they did find that senior centers and home health care and personal care assistance and hospice and transportation, home modifications, these things were important.
Okay, again, let's see. Please mute your mics.
No, I'm not.
Next slide.
Okay. All right.
So these are some of the interest in these areas that were surveyed. Again, should come as no surprise. Again, it was healthcare, financial security, food, housing, and caregiving, pretty high interest in these areas. Next slide.
Okay.
It's a bar chart.
Okay. All right. Sorry. Okay. There you go.
Okay. So elder abuse is a big part of what the State Unit on Aging addresses with our legal services, and financial exploitation often starts with online problems. And as you can see, that was the #1 type of elder abuse that people had heard of in this survey. Finding reliable information online is important to address all of these issues, though, which again should come as no surprise to those of us that are using the internet. Next slide. As you might hope, and we saw in the survey, adults are using the internet 64% of the time, and 45% are asking family and friends who we expect they are probably also using the internet. So it's a big part of how people do research all over the place, but especially in rural areas. Next slide. So we learned that telehealth has been limited due to internet access in rural areas, which Gina touched on a little bit. And besides unfamiliarity, the availability of broadband internet is limited. The cost is higher in rural areas, and there are areas where only satellite service is available. Senior centers are seen as a reliable source of information, and some senior centers do offer online access. And we have found it's important that senior centers have broadband service. And one idea might be to be able to provide that service for free to those centers. Next slide. So we also did a survey in conjunction with the UNL Extension Office. And then I'll talk a little bit about what we found from the senior centers across the state and their internet availability. We do have a copy of that report upon request. It's very hard to follow unless you know what you're looking for, I guess. We have a lot of slides on it. Next slide. The State Unit on Aging conducted the survey of senior centers, like I said, in conjunction with the UNL Extension Office. We were both gearing up and we offered to fold their questions into our survey. They are developing nutritional programs for older adults in senior centers. So they wanted to get some basic information before they went out with that. And we're very persistent and we had a really good response. So of the surveys that we received, 80% do have internet for the workers, which was surprising to us. 76% had computers for their workers and 67% had Wi-Fi for everyone. 30% had computers for everyone, which again, we found surprising because we had been sort of anecdotally told that they did not have a lot of internet availability. 28% even had virtual meeting equipment for everybody. And I think with a little bit more funding and equipment and that access will go a long way. Next slide. This is a list of what senior centers said that they wanted, which, as you might guess, would be computers for everyone, telelearning, Wi-Fi for everyone, and those without wanted internet for their workers. Next slide. So with the centers, the technology importance varied, but with most of them having email, this data was not surprising, but did give a pretty good summary of that. So next slide. We at the State Unit on Aging purchased classes from a company called Get Set Up. Next slide. Oh, no, back. Sorry. We saw a need for more digital literacy for older Nebraskans before the pandemic and certainly during the pandemic. We had a little bit of money to try out an online training platform and we're kind of dipping our toe into that water with this contract. Get Set Up is an online learning platform for older adults to learn in small interactive classes about their device and get comfortable with online activities. Once you learn how to use your device, you can join a Zoom meeting, any Zoom meeting, and you can use any online services and participate in any training. Doesn't have to be this platform, it can be any platform. This is one way to learn how to use your device and participate in telehealth with medical providers once that gains a little more popularity. And something that rural Nebraskans can really use, avoid the trip to a larger city if it's really not necessary. And that capability can save on time and gas to start with. Next slide. So the contract that we have with Get Set Up is for 20,000 online classes. The contract runs from March 22 to March 23. So far, about 10,000 classes. Back up. The slide before that.
Okay.
The classes are taught by people age 50 and over for adults age 50 and over. And the classes are not exclusively about aging, but they focus on aspects that are age related. With the interest and funding from the legislature, broadband is being made more available to rural areas. And this seemed like a good time and a great fit for this kind of education for older adults in Nebraska. With an increase in online literacy, we can fight fraud and other forms of elder abuse. We presented this information to the Library Commission in May, and hopefully it's alleviating some of their technological load at the local level. We will have a no-cost extension on this contract, so we'll use up all of the classes, even though the contract would have only been for a year. Next slide. So the teachers are from all over the world. There are approximately 4 million adults taking classes now in 160 countries. People who want to learn more would need an internet device and a phone number. They'd be asked to set up a password. The class times follow you from where you're logged in. So I'm in the central time zone, and it would show my time zone for any class times. If I go to Arizona, it'll show that time zone. And all of the classes have closed captioning available. All the classes have a technical person available in the class in case something goes wonky. Classes are limited in size in order to provide interaction with the instructor. The first two classes that they recommend are orientation related, getting comfortable with the device that they're using and learning how to use Zoom and learning how to sign up for classes. Those are skills that, like I said, you can take to any online learning platform. I like to use my mother-in-law as an example. She's not a fan of Zoom, and she could not wait for the reopening of everything. But she and her friends played bridge online during the pandemic. There's an international bridge playing platform. I did not know that, and one of her friends found it, and so they were able to chat on their phones and play bridge and, you know, still have that social interaction that was so important. She's still not a fan of the meetings, but she can now attend one without any additional help from those of us at home. Next slide. Oh, back up one. It's the one of the screen. This is what the home screen looks like, and I have an account, and this is what I see when I log in, and just sort of informational. So then the next slide. This is just a list of classes that we have offered. We've had some really good media coverage so far. A nice article in Government Technology and a piece on KLKN, radio piece on KOL, and most of the seniors, the area agencies on aging have run articles also. So right now there are 8 states participating in contracts with Get Set Up. And we've had, oh, this needs to be updated. We've had 8,000 people take classes. Next slide. So this is data early on, but no big surprise. The cities that are mostly participating, we've had 75% women participating, and then the mobile device breakout, which is sort of interesting from the metrics that we can get from this. Next slide. So this is a list of the resources that we presented in this, the Aging Network, our State Unit on Aging website. We have the links to Get Set Up also, and the UNO survey report is posted there. And like I said, the Senior Center survey and report is not published, but I could certainly send it to you if you were excited about that. And one more slide. So this is my joke, but wait, there's more. We do a lot of stuff. One of the things that we do is the annual Elder Justice Training with support from UNO and AARP and some others. And previous training sessions are available on the website and our ADRC database for the, so a lot of what we do with that is also digital focused. And I think we're going to do a little more digital focus this year. That class or that training is August 16th, and it'll be free CLEs and CEUs for professionals working in the field. And additionally, our Aging and Disability Resource Center database has combined with 211, and you can call them for connection to statewide or local services. And the last slide is just my name and phone number and email if you want to get a hold of me.
Okay.
Thanks.
Thank you, Cynthia. And I apologize for my slide advancing. I realized that sometimes when I was clicking on some of the little Zoom boxes to check on muting people and was clicking that it was advancing slides. So a bit of a learning curve there. So
It's all good.
it looks like I have a question from Adam Martin about for you, Cynthia, about would you be able to share the raw data from your senior center survey after the meeting? And I think you already kind of addressed that, but if you want to answer, Adam. Yeah, are you on mute, Cynthia?
Yes, I am, because that's so helpful. So my email's in the chat. Send me a note.
Okay, thank you. And with that, I'm going to stop screen sharing. And we will move to Carla.
Hello to all of you. It's wonderful to have all of you present here. I want to thank Anne for inviting me and Cynthia for what she does for all the AAAs in the state of Nebraska, and also Gina Ragland. She does a supreme job with the ARC Foundation for all of the citizens that our agencies serve. I am one of the 8 area agencies that are located in Nebraska. Our area agency, Blue Rivers, is located in the southeast corner. We cover 8 counties. So we are very rural, as you can imagine. I was looking through some papers as I was preparing what I was going to talk about today. And from the Nebraska 2021 census, there are 46% of the Nebraska population is 50 and older, which is 909,183 citizens, because I like to put things to numbers. It was very eye-opening to me, and also it shows that we are going to be very busy, keeping the people home, aging in their homes where Gina said 90% want to stay. I want to stay aging in my home. I know that for sure. And digital equity is going to be a must for that. It's encouraging that we have already received $87.7 million for Nebraska to increase broadband internet access, and that Nebraska is expecting another $100 million of federal funding to keep this expansion in place. I'm proud to say that our state has been expanding this broadband access. It's been a priority for our state lawmakers since 2018 with the creation of the Rural Broadband Task Force. That says a lot to me. So no matter where Nebraskans live from a city, they need to be able to have access to the online tools to live, learn, conduct business, and then for our clients to stay connected to family, friends, play bridge, like Cynthia's mother-in-law, as well as the telehealth opportunities. It's very, very important. Through the state advisory committees of the AAAs, there is a newly formed organization called Energizing Nebraska Senior Centers Committee, and they are working on identifying the needs, and they've identified Wi-Fi services as a big need for all of our centers, and that training on cell phone use and management is also beneficial and important to all the citizens that come to our centers and those that don't come to our centers. So we somehow need to be able to reach the folks that are homebound as well. So it does become a very big challenge to accommodate these citizens of Nebraska. The UNL survey that Cynthia Brommeyer was talking about, and that as she stated, 64% of the seniors utilize an internet search to find out about the services that are available. So this tells me that it is very important that they know how to do a simple Google search, which may sound simple to all of us, but it isn't always simple. And also how to learn to navigate a computer and their smartphones and have access to both of those. So, and the first issue that was identified is that access in the rural areas, which we can hope that in the next several years is going to happen. I'm located actually in an area where I have terrible internet search. So I'm very excited that I'm in North Gage County, that is coming. I've been told by the Gage County commissioners that they have put the flags out on my road, and I'm excited because it is very, very difficult for me to work from home. I don't have very accurate internet there. So that was number one. The second is the cost to secure internet services for our clients. Many of our clients have to choose between internet access and their other necessary living expenses. So there has to be funding made available to low-income elderly to secure internet access and also a smartphone or a simple tablet, something like that. The third concern is digital literacy. Keeping up with the ever-increasing updates and changes to technology requires training. We all have to do it. I feel like I learned something new. I just did today on how to blur my background. It's ongoing. It's every day. We all have to do that. So funds do need to be secured for this portion of the digital need. The fourth concern is security and the vulnerability that they feel towards identity theft. That's they've been told over and over about identity theft, fraud, be concerned. That is a very big concern for them. And the final issue is the access and use of telehealth. So, and at this time, a small minority of the citizens use through, and this is from the UNO research that they did. We also need to note that I need to tell you that our staff in our centers, they're there, they do help their seniors. They're like their family. They help them with their phones when they can. They refer them to the AAAs, to the offices on how to access different services. I know that care managers and ADRC counselors, our Aging and Disability Resource Center counselors statewide do work with clients so that they can access benefits that are available to them. And the definite barriers exist for centers is the lack of funding available for the equipment and the Wi-Fi, as well as trained staff to assist with this technology needed. Anne asked me to identify some items that a state grant program could assist centers with. I've touched on that a little bit, but to finalize, the centers, all centers statewide must have access to Wi-Fi. And also they have to have available funding for the computers. I love the idea of having a computer lab where someone would come in and a speaker could come in and could work with, 2 or 3 hours for people for walking clients on basic cell phone management or basic tools on how to get into Google. And so they can access those wonderful programs that Gina showed available, and also the Get Set Up programs that are available. I know one of internet costs have to be affordable for all and available for those who cannot afford it and then have to choose between a meal and internet. And one of our goals for our agency is to be hosting Zoom events regarding evidence-based programs such as Stepping On, Tai Chi. We have a multitude others that we are working on so that we can do those from one area and Zoom those out to centers. And we need to make sure that our staff are trained to know how to turn on and get to a Zoom meeting and be available there for any questions with the staff or with the clients that come. So we know that we need to have this equipment and strong Wi-Fi available. So that was my short spiel on our AAAs and the work that we do to provide the digital equity towards the citizens.
Any questions for any of our speakers? I know I have one, and I see one from Tom Bliss, but if anyone else has any, please put them in the chat. My question, Carla, you mentioned the issue of cost and affordability.
Mhm.
And the FCC does have a program called the Affordable Connectivity Program, which
Okay.
provides a discount of up to $30 for an internet connection. So it could be for a mobile carrier or a home provider. Do you know if there are any outreach efforts about letting people know about that program?
No, but if you can send me some information, we do outreach at our centers all the time. I have staff going all over the to all of our centers. So that would be great information to spread about. We can also put that information into our home delivered meals and all of our centers. We you know, 2,000 to 3,000 a day. That would be awesome information to get out. I know I did read something about that a longer time ago. I was trying to find the research on it yesterday and I missed that, but I do know that would be available. So,
Okay, I will send you some information on
Okay.
there.
thank you.
And then Tom had a question for all the panelists. Are there programs for older migrant populations?
From my perspective, I'm not aware of a specific focus for migrants, and I don't know, and that obviously that's one of the populations that falls into the digital equity focus, and I don't know if any work has been done on that specific outside of, but I very much appreciate that comment, and I think that that's a vital part that should be looked at to be included in, you know, as far as any training that goes on with anything that we do with the Oats or Senior Planet or whomever that licensure is. You know, usually it's potentially relying on a volunteer on site if they have the capability to connect with them, if it's a, you know, a language barrier or whatever that might be. But I think you've identified a very good point of something that's probably is lacking that could be looked at to be included in the grant moving forward. That's just my opinion, but
I would agree. We don't have that in Southeast Nebraska, but I'm sure that right north of us in the Omaha, Lincoln area, that would be a very necessary need.
Any other questions? I see that Aaron put in a question about renewing the Get Set Up contract, and Cynthia answered that. But any other questions for our speakers? Well, I'm not seeing anybody, or if anybody wants to unmute themselves and ask a question. Okay, well, I would like to thank all of our speakers. And I guess before I let you go, there are just a couple things. Upcoming webinars, and I'm going to try to share my screen again. Okay, our next webinar on February 1st is on benchmark data and precision ag. On February 8th, we'll have a bi-week. February 15th, access to digital devices. We'll have two speakers, Brian Whitaker and Beverly Lallam Taylor, speaking about that. February 22nd, we'll have a webinar on broadband availability, the FCC broadband map, plans for a state broadband map, coordination of BEAD and digital equity outreach with representatives from the Public Service Commission. Another week, a bi-week on March 1st, and March 8th, we'll be looking at maker spaces and digital equity organizations. So I hope that you can attend. our future webinars, and it looks like I got something new in the chat. So I think that is it. And here's my email if you'd like more updates, information. Please feel free to contact me. So the websites will be posted on the NITC website. I'm a little behind on that, but they will be posted there. So with that, I will end the webinar and thank everybody for participating. So thank you.